Good afternoon, everyone. Thank you for joining our Wellbeing at Work webinar this afternoon. I'm Becky Harrison. I'm a Claims Relationship Manager within the Zurich customer team. Before I hand over to the presenters today, I just wanted to cover off a couple of things. If anybody is having issues with sound, viewing the slides, we often find that leaving and rejoining the webinar resolves that. Cameras and microphones are switched off, but the Q&A and chat function is available. So please pop any questions in there throughout the webinar, and there will be time for those to be picked up at the end. The webinar is being recorded, so we will share a copy of the slides afterwards. And lastly, there will be an opportunity for feedback at the end. So we would kindly ask that you complete the very short survey. It's an opportunity for us to learn and improve, but also consider any future topics. And with that, I will hand over to Dave.
Great. Thanks, Becky. Good afternoon, everybody. My name is Dave Hounsell. I'm Senior Risk Consultant with Zurich Resilience Solutions. I've worked with Zurich for 10 years now, providing advice to the public and private sectors on a range of health, liability and well-being issues. I think wellbeing at work is probably the most complex issue that I've ever had to deal with in the 25 years I've worked in the health and safety profession. But it's not an impossible one to manage and to understand. And I hope to give you a little bit of insight and food for thought today. So I'm just going to talk through these four things just by way of a bit of an agenda. So the implications for your organisations, main bit around risk management and claims defence, how we can adopt a range of collective and individual approaches to managing mental health and well-being, and then a few sort of questions and indicators around how are you doing. So the first one, it's talking about implications for your organisations. And one of the first things really is the sheer scale of the issue, not just the negative aspects, which often get focused on, but also the benefits that can be gained from getting it right. There's also the scale and potential complexity of putting the structures in place to manage well-being at work. Yeah, is it a learning development issue, an HR issue, a health and safety issue, a financial issue? Even the definitions that people use can lead to some confusion. So we'll have a quick look at that with the three definitions that I've put up on the slides there. So the new, the ISO standard and the World Health Organization mental health guidance that came out in the last 3 years, they both refer to well-being at work. They refer to psychosocial hazards and also psychological health and safety. But the common sort of thread is that they put the emphasis on preventative action, as well as building personal resilience and having a rehabilitation offering in place. There's several definitions of well-being, but I think the key element is that a person, an individual, needs fulfillment in the four areas that are mentioned there, in social relationships, in financial security, in physical health and mental health. So we can think of well-being as a holistic approach. And employers really need to accept that the workforce doesn't always leave external problems at the door. Employers may be able to support an employee with a range of issues, but they can actively manage psychosocial health and safety within the workplace. UK health and safety law does not differentiate between physical health and mental health. An employer must manage both according to the risks present in their workplace. And I advise using a similar risk management approach for psychological health and safety as you would use for physical health and safety. The HSC definition of stress focuses on harm that can result when the demands on a person exceed the resources they have to cope. The slide gives some of the HSC stats that you may be familiar with around the impact of stress at work, and it gives us an indication of the scale of the issue, the typical duration of absence from work, and some of the leading causes. And for those of you that have more than just a UK presence in your business, a study in April 2004 in the Safety Science periodical analysed data across 45 countries. It noted the top global psychosocial concerns are harassment and bullying, which tend to come within the workplace rather than external factors, work overload, discrimination, and poor work-life balance. The paper also notes the main driver for managing hazards is workplace senior management support and having specific national regulations, which in the UK we don't have. And the main barrier being poor resource availability. And we can think of the implications in sort of two bits. One, supporting the sustainability of the business, not just sort of the environmental context, but the actual, the ability for the organisation to grow sustainably in its business activities, and also a more conventional way of managing costs. As long ago as 2014, Department for Business Innovation and Skills reported that there was compelling evidence that higher levels of life satisfaction and effective feelings have a causal effect on mental health and longevity. Mental health also has an indirect effect because individuals with better mental health are more likely to engage in health promoting activities, behaviors and practices, including positive social relationships and better physical health. So there's a virtuous circle effect with mental health and well-being. Better mental health improves our physical health and helps reduce losses both to the individual and to the business. Secondly, the report noted that better mental health and well-being positively correlates with increased creativity, problem solving, processing of information, and even risk-taking. Interestingly, a strong positive correlation found between job satisfaction and what they refer to as organizational citizenship behaviors. For example, support, respect for each other, civility. So workers who are well are more likely to behave in ways that improve workplace culture. It's diversity, equality, and inclusion. Again, we see the link between mental health, stress, and workplace culture, a holistic approach. And the last implication on the sustainability side, it's worth talking about is assurance. Using a risk management approach that aligns to the ISO standard or one of the ESG reporting frameworks can provide your stakeholders with an assurance that risks are being effectively managed and that you're a good corporate citizen. If we look at the other side of the coin, managing costs, on the employee benefits side of the insurance business, particularly income protection, we know mental health represents over 20% of income protection claims. It's the cause of 54% of return to work support requests, regardless of what the actual reason for why somebody is off work. And the average cost of an income protection claim is nearly $300,000. The highest number of liability stress claims are in the cost range of $50,000 to $100,000, so much higher than your typical EL claim. And commonly they take around 2 years to settle, so that's a lot of time and effort going into it, as well as the emotional toil, trouble that it causes. Most liability claims are defended, and Zurich considers each on its merit, but they are time-consuming. Mental health support within our claims proposition, such as Mo's going to talk about later with workplace options, was very effective at 1, reducing absence, 2, successfully returning a person to work, and 3, reducing the likelihood of a claim. Increasingly, ZRS, part of the business that I work for, is looking at the relationship with other losses, for example, physical injury, road traffic collisions, traumatic events, and even property loss and mental health impact. A more holistic approach across motor and casualty, for example, and even property risk. Psychosocial risk and mental health are complex issues, and it can pay dividends to have an organisation such as ZRS work through policy, strategy and practices with you to provide that sort of third-party objective view of how you're doing. I mentioned the ISO standard just now, and your organisation may not use any of the ISO standards. But as risk managers, I'm sure you'll recognise the sort of iterative process here, the plan, do, check, act approach that most management systems have. So this is the one from ISO 45003, Guidance on the Management of Psychosocial Risks and Promoting Wellbeing at Work. This is a supplement to ISO 45001, which contains the requirements and guidance for occupational health and safety management system. Within the ISO, psychosocial hazards relate to how work is organised, social factors at work, and aspects of the work environment, the equipment, and hazardous tasks. Psychosocial hazards can be present in all organisations and sectors, so this idea of a low-risk industry for psychosocial risk doesn't really apply. Using the ISO as a framework for managing psychosocial risk gives several benefits. It provides a familiar management systems framework for organisations who are already registered to one of the ISO standards. It's the same if it's 9001, 14001, 45001. If your employer doesn't use an ISO standard, it's still recognisable with the plan, do, check, act approach. It focuses on aspects of psychosocial risk and mental health and well-being that are in the employer's area of control, or at least their influence. The way in which work is organised, for example, work demands, social factors, work relationships, for example, and the psychosocial aspects of traditional risks associated with equipment, such as ergonomics, tasks, say dealing with challenging behaviour, and the workplace itself, like noise. A systematic risk-based approach to the management of mental health and well-being can help create a positive working culture that helps people to flourish and perform at their best. If you're to ask me for the top 4 actions an organisation should take to get things going, I'd pick the 4 that are shown on the slide there. Review your strategy and policies to identify gaps. Where are you now? Where do you want to be? Actions to close the gap can form your strategy and be communicated to gain commitment from both leaders and the workforce. Secondly, carry out psychosocial risk assessment. ISO, Health and Safety Executive, World Health Organization all recommend that organizations adopt this approach to identify, assess, and manage psychosocial risk within the workplace, even if the organization doesn't adopt a formal occupational health and safety management system. Thirdly, train your managers in mental health and well-being. The relationship between line managers and the people that report to them is perhaps the most critical in determining workplace mental health outcomes. Success requires managers to understand how work is done affects mental health. And lastly, the 4th one, raise mental health and wellbeing awareness within the organisation, something I tend to refer to as the mental health and wellbeing literacy of the workforce. All workers need to be confident and comfortable to reduce stigmatising attitudes and to know what support is available to help them flourish. Promotion can include actions taken to reduce risks, as well as techniques for personal resilience and, if necessary, sources of support for rehabilitation. If we look at the elements on the within the 4 hexagons on the slide there, we can see that iterative approach to plan, do, check, act. The context is about the environment that your organisation operates in, applicable standards, laws, external and internal issues, organisational performance, and also the nature and expectations of the workforce. Remember, the first definition of well-being was around people's expectations or their need to fulfil social, financial, and health issues. Leadership and worker participation is very similar to any other management system. The strategy needs to be led from the top, but it must actively involve and represent all the people affected by it. Clause 6 asks the organisation how it plans to assess psychosocial risk, to prevent harm, help people return to work, and to maintain the psychosocial management system and to continually improve it. The plan includes a standard for psychosocial hazard identification and potential risk controls, plus who and what to involve in that process. Methods of operational risk mitigation are described in Clause 8. So it should include the assessment, the signs of exposure to psychosocial risk, existing controls, and the management of change, one of the sort of the 6 main causes of stress the HSE standards identify. And when managing psychosocial risk, a combination of interventions will be used, normally described across 3 levels. Firstly, primary interventions, organisational level controls that prevent or reduce harmful effects and promote well-being at work. Secondary interventions, increase resources that assist workers to deal with psychosocial risks by raising awareness and understanding through effective training and other appropriate measures. And lastly, tertiary interventions, reducing the harmful effects of exposure by implementing rehab programs and taking other corrective and supportive actions. Performance evaluation. This wouldn't be a risk management presentation if I didn't say something like you can't manage what you don't measure. Fortunately, there is quite a lot of data that most organisations have available to them to help understand and assess these risks. People often take it meaning as quantifiable data, and whilst that is definitely has its place, it would be a mistake to not also collect subjective data around experience, opinion, and ideas from the workforce. So performance measures can include active sources such as employee forums and surveys, as well as reactive sources, sickness absence, claims, and hours worked, for example. And the last bit I'll mention in this little section is the importance of good record keeping, something that risk and insurance professionals among you will be well versed, I'm sure. So Part 7, systems support, includes the need for accurate and retrievable documents and records. And the following have been shown to be particularly important for stress claims defence. So clear policy, so for having a clear policy for reporting stress and mental health and wellbeing concerns, and that this has been communicated to employees and it is being followed. A suitable and sufficient psychosocial risk assessment process with appropriate risk controls identified and implemented. Assessment and interventions for vulnerable persons. It's particularly important where people have begun to describe signs and symptoms that they are experiencing stress at work. Contemporaneous notes of meetings with such individuals who are reporting symptoms and of any actions taken in response to adapt their work or the workplace. And lastly, keeping up to date with good practice in mental health and well-being. It's not a static situation. As I mentioned, it's certainly 3 years ago, we had new WHO guidance and ISO standard in the same year. And quite a few countries now, Australia and Canada, are starting to implement legislation in this area. And I said for part 3, we'd look at collective and individual approaches. So we can think of operational risk mitigation as falling into those sort of 2 broad categories. In my experience, most organisations tend to put more emphasis on the use of individual approaches. These can be very effective at an individual level, and they really, their weakness, I suppose, is that they rely on the individual choosing to engage with these sorts of interventions. There's been many studies over the years that look at the relative effectiveness of different initiatives. Some of the better known ones are Deloitte's Mental Health and Employers, the HSC's Evaluating Interventions in Work-Related Ill Health and Disease, and the WHO Guidelines on Mental Health at Work. Came out in 2022, but they also have a model from 2010, which is an oldie but a goodie. It's worth seeking out. So I'd encourage you to review these to identify what might best suit your purposes, situation, and your intent. Remember, you also need an effective communication strategy in place to support these initiatives. People need to be ready to hear and able to engage with what you're doing. It's worth noting from the Deloitte report, this fits in with our use of and description of a holistic risk management approach to wellbeing in the workplace. Deloitte noted the interventions that achieve higher returns of around £9 return to £1 invested tend to have the following characteristics. They offer large-scale cultural change or organisational-wide initiatives supporting largest numbers of employees. They're focused on prevention or designed to help build employee resilience. And they use technology or diagnostics to tailor support for those most at risk, i.e. it's targeted to those most in need, which fits in with our concepts of risk assessment, reasonable adjustments, and claims defence. So interventions in the collective group tend to focus on prevention and risk mitigation. Individual interventions tend to focus more on resilience and rehabilitation. So the last little bit I'm going to leave you with is how you're doing. And this will obviously be in the recording for you to sort of have a think about. Afterwards, it's always worth sort of reflecting on these things, I find. So there's certain questions that I would suggest you critically think about your own organisation, the degree to which you can answer these, and how much depth those responses have. And secondly, there's going to be certain exposures and indicators that might mean it's more likely you may have a problem, or that problem may be more significant than it might be in other sectors or other businesses. So if any of this strikes a chord with you, come and talk to us. Whether you need a check on strategy or policy, risk assessment method, management training, or developing your rehab program, Zurich will have something for you. So that's the end of my presentation. And with that, I'll pass over to Mo.
Thank you, David. Hi everyone, my name is Mohsin Khan, or Mo, and I am a Global Account Manager at Workplace Options, a support service provider to Zurich. So we are an independent organisation offering a wide range of support, which you will see in this particular presentation. So in terms of the support service, similar to an EAP, an Employee Assistance Program, Workplace Options and Zurich have developed a program called Support Service, offering support to employees and to their immediate family members. It's a free, confidential service that they can access at any point. If and when they have an interest or requirement for something that is that's come up in their life, whether it's personal or work related, they can connect in and speak to one of our trained clinicians at any time. So the service is primarily there to support employees with everyday life challenges and needs. A common misconception to the support service and general EAPs is that it's purely targeted at work-related matters, and that is not the case. So we are here to support, as David mentioned earlier as well, a holistic perspective, and we'll see everything that we can do to support employees and assist them in everyday challenges that they might be experiencing, and I'll discuss this in the coming slides. So as I mentioned earlier, the support is available 24/7. One of the key features of the program is that when an individual does connect in and speaks to one of our representatives, they're actually speaking to a trained clinician, a clinician that can support the individual at that particular time. So they're not being triaged, it's not a customer service representative that's answering the phone. They're actually speaking to a trained clinician that can support them. And that's a great feature, because you could have an employee who might have an issue at 2 a.m. about something that may have come up in their life. They may have had an argument with a spouse, or they may have had suffer with some sort of anxiety because of a particular incident. They can call in and speak to a clinician immediately. So that's a great feature of the program, and something that we do promote to all of our clients. The accessibility to the main services is free of charge. This has already been paid for, so no employee would require to make any payments to the support service. As I mentioned earlier, the service is obviously predominantly there to support the employee, but it's also available for managers, and it's also available for immediate family members. And when we're referring to family members, this is a typical household. The individuals don't have to reside and live in the house, but it's a typical household, which would be, it could be your spouse, your children, partner, siblings, parents, so typical household. The support that we provide is offered in the employee's preferred language as well. So it could be that an individual is living in the particular in the UK. They speak English perfectly fine. However, when it comes to speaking about any particular emotional issues and challenges that might be experiencing, they prefer to have that conversation in their preferred native language, and that can be arranged. Another point I want to kind of reiterate is that Workplace Options is an independent organisation offering impartial support to your employees. So employees are accessing the service will know that this service is being offered through Workplace Options, and the service is fully confidential. No one at your organization will know that a particular employee has accessed the service. It's fully confidential. All of our clinicians, account managers, staff will sign confidentiality agreements to ensure that it's always at the forefront of our minds. Many people can be understandably a little nervous when they're using such a program like a support service, when they're speaking to a counselor about a work-related issue or a personal issue. They may think that the information may find its way back to their employer or to their manager. And we assure the employees that this will not happen. The service is fully confidential. No names or ways to identify any individuals using the service will ever be shared. So the service is fully confidential, and we pride ourselves in that. We do ask a few questions when someone is connecting in. It could be, what organization you're associated with. You can mention your Zurich municipal or commercial based employee, or you can mention the company name, and we'll be able to locate the account. But the questions that they will ask from that point onwards would be names and contact information. And the contact information is important for us to have because we require it to then help you complete a particular a particular requirement. It might be a challenge that you're experiencing, an issue that you want to overcome, and it requires ongoing support. And for that reason, and to kind of help you in that journey, it's important for us to have that information so that we can help you get through those various stages in terms of your development and improvement in various areas of your lives. If someone wants to remain anonymous, that is also possible. So as we're also talking about confidentiality, there are going to be occasions when someone might not be comfortable about sharing their contact information. In those situations, we can offer in the moment support. So anytime that an employee likes, they can call in, remain anonymous, and they can speak to a clinician there and then, and to get some sort of support. But to proceed and receive ongoing support and structured support, or referrals to a particular area of interest, it's important for us to have that information so that we can then help proceed further. So we support for your total well-being. So you can see some areas in your lives that such a program becomes very, very powerful. And we use a holistic approach. It could be that you've called in about one particular issue and that has resulted in multiple levels of service. And some examples could be it could be health. For health, an individual might call in because they've just recently been diagnosed with diabetes, for example, and they want to receive some counselling support. At the same time, they also want to get some information around healthy eating, or be referred to a dietitian, amongst other things. So we can help with that. For work and study, it could be locating a nursery close to your office. It could be finding information on schools. It could be thinking about moving abroad, and you can help with that by finding information and supporting you for all of those areas. And family, this can be similar to finding a nursery or a school. You could even discuss ways to start and form a family. You may want to look at what providers are out there for IVF treatments, for example. It could be you have a child of yours who is being bullied at school and requires some support, and we can offer family counselling, or we can even offer individual counselling to children from the age of 8 and above. So that's individual counselling for children from the 8 and above, and family counselling for children from the age of 5 and above. And then personal, this could be very broad, finding a gym to finding a plumber or builder. It's very, very broad. So when we support, we can find information, we can refer you to providers, we can support you by offering counselling amongst other services, but we also use a holistic approach. And that approach, like I mentioned earlier, it could be that you've called in about one thing, and that might result may mean that you may have multiple levels of services that are required. A common example could be actually an employee calling in and they want to discuss a bereavement. They've lost their partner. So we've offered obviously counselling support for that bereavement issue and offer them some support. At the same time, we've understood from that call that the employee is also going to now unfortunately be affected and impacted financially because that partner of theirs was also earning. So that's going to affect their mortgages and stuff like that. So again, we can have that discussion. We can signpost them to legal or financial consultants, amongst other things. So so just giving you some kind of examples on how it potentially can be used. Now, in terms of the support, the most commonly used service within such a program, like the support service, is our counselling support. And the counselling support is offered through one of our trained clinicians. So as I mentioned earlier, when you call in, when you're speaking to a clinician, they can support you and offer you in the moment support. There are going to be occasions when an individual requires ongoing support, and for which we offer up to 5 sessions of counselling. So that's 5 sessions of counselling per issue per year. This can be delivered in person, it can be delivered over the phone, or it could also be delivered via video through our app, which we'll be launching next month, called Balancy. So information will be shared on this in the coming weeks. But the short-term counselling option is there for those individuals that have an issue that needs to be resolved within a 5-session model. Like I said earlier, there may be occasions when individuals issue is it might just require in the moment support, and that issue can be resolved on that one call with that counsellor. But there are occasions where the issue is slightly a bit more complex and requires up to 5 sessions of counselling, and this is delivered on a weekly basis. We ask the employee to confirm how they would like to have the session, their language preference. For example, if they want to have it in person, does it need to be close to their office, or does it need to be close to their home? We can ask all of those sorts of questions. So that is all kind of determined on that initial call that you're having with a clinician. There are going to be situations that are not suitable for short-term counselling. It could be a very complex situation, and that could be an individual who has experienced trauma and received counselling for this maybe a year before, and then connected again because that issue's come back in their life. 5 sessions of counselling will not resolve that. And what we would typically offer is transitional support, so offering that 1 session and then referring the employee outside of the support service program. And that typically would be a long-term specialist outside of the program that might have a cost associated with it. There are also options like finding a local charity, local Samaritans group that can also offer free support. So we can look at all sorts of avenues as well for the employee. When we are looking at and locating a counsellor for the ongoing support, it takes us 2 to 3 business days from that initial call that the individuals had. And that from that call, the individual can have their first session within 5 business days. So it's a fairly quick turnaround in comparison to, for example, being on the waiting list on the NHS, for example. So next, I would like to talk about another service which is also available, and this will be available from 1st of June. So from 1st of June, this service is going to be available, and it's called CCBT, In My Hands Computerized Cognitive Behavioral Therapy. So this can be an effective treatment option if someone is experiencing anxiety, stress, or mild to moderate depression. In My Hands is an online program, so it's an alternative option to traditional telephonic or video or in-person counselling support. So it's an ideal option for those individuals who prefer a self-paced digital-first experience. So the program comprises of 7 modules to show you on how to apply CBT concepts to change the way you perceive events and how you feel about them and how you react to them. The modules also include focus on self-esteem, thinking styles, low mood, depression, stress, anxiety, and coping, and building resilience. The program also includes tip sheets, videos, and web pages. So whilst the program is a digital experience, we do assign a case manager to you for that particular case, and that individual will help track your progress, connect with you to ensure that you are benefiting from the program. And if you feel there's other requirements, then that will obviously be determined by the case manager, who can then discuss other things. So all of the services that I will be mentioning in the coming slide, all of these slides now, are accessible for employees and their immediate family members. I just saw a question just pop up, so I just wanted to kind of answer that whilst we're in the flow of the presentation. We also offer a program called the Aware Mindfulness Program. So this is a program which offers 6 weekly telephonic-based mindfulness stress reduction sessions. It's also inclusive from the 1st of June, and the first session takes about 45 minutes, and then the subsequent sessions take between 15 to 20 minutes long. The WARE program is a very useful program. It helps individuals focus on being in the present to support their overall well-being. You are paired with a dedicated aware specialist who is a well-being professional trained in mindfulness principles and holistic well-being. Together, you will develop a customized mindfulness practice plan, and each weekly session includes education resources and support for your plan and mindfulness exercises. So people who have actually completed the AWARE program report an improvement in their ability to focus, sleep, and a big one, which is effectively manage stress. I have actually tested this myself just before my daughter was about to be born. I was suffering with some sort of anxiety, which I never experienced in my life before. And I went through a couple of these sessions and found the breathing exercises and some of the other techniques really, really powerful and really useful. And I still use these if I ever feel that way. And I feel, that my issue has been controlled since accessing this. So real powerful tool, and it comes in multiple languages as well. We also offer life coaching. This is for personal professional development. Again, accessible from the 1st of June. This program offers up to 6 sessions via telephone or video with a professional coach, and this can help you establish your personal vision, determine your goals, and create an action plan to achieve and get to those goals. So you can use this for personal or professional development. Could be for things like time management, improving on work or personal relationships, amongst other areas. So all of those services were that I mentioned earlier were part of the emotional support category. Apart from the short-term counselling, the rest will be accessible from the 1st of June, and we'll be sharing some further information on this with Zurich, and they will be promoting this further. An employee can ask for those services or discuss the issue, and the council will recommend those services. So just wanted to kind of point that out. Our practical support, which is information on local providers and resources, is basically available again through the support service, we have professionals available 24/7 that can help in various areas. The areas are from things like dependent care, financial matters, legal, and daily living. So we can help with a number of things: finding information, signposting you to providers, amongst other things. So examples could be finding a care home for your aging loved one, to finding a nursery or a nanny, to finding a solicitor or a lawyer about a particular query that you might have, amongst other things. So I'll give you some examples in the coming slides. But we aim to find between 3 to 5 confirmed resources in that area of interest. We can find information that might be readily available on your government websites, and we can share those across with you. And it takes us 2 to 3 business days to turn that around as well. So here's a few examples. So firstly, for elder childcare, this can be for things like finding a nursery, a nanny, or an activity for your child. We can help locate these. We can even find a care home for an aging loved one. We can find information that might be available around how to care for an aging loved one who's going through a certain health condition like dementia, Alzheimer's, Parkinson's, amongst other health conditions. So we can locate information and share that with that employee and carer. We can also find information on benefits that you might be entitled to as a carer for an aging loved one, amongst other things. So we also offer financial legal consultation. A 30-minute free consultation and can be offered for any particular query that you might have. It could be around money management, budgeting, family law. It could be writing wills, consumer rights, amongst other things. So it's very broad. We offer free 30-minute consultations with a provider. All you need to do is connect in and speak to our Workplace Options team using the same contact methods. We'll then collect the information, and then find a provider who will then make an outreach. They will contact the employee within 2 to 3 business days from that query. We can also refer employees to providers. So you might be looking for a solicitor, you might be experiencing or going through a divorce, for example, and we can locate between 3 to 5 confirmed legal professionals in your area of interest, and we'll give you the details over email. We'll qualify them to ensure that they're available, that they meet the need, and we'll give you the details of them via email. And for financial referrals, we can refer you to experts in pension, savings, amongst other things. So if and when we are referring people, if there's a cost associated with that, we'll make it clear to the employee that there is a cost. This is outside of the support service program and it's up to you to facilitate any particular payments that are linked to it. And then lastly, daily living. And daily living is very broad. We can help locate travel information, finding information on holidays, helping with event planning, like it could be planning a birthday, finding a venue, to finding a cake decorator, to other things. It could be, you might have just purchased a new property and you don't know who to contact for plumbing work and electrical work, amongst other things. So we can help with finding these tradespeople. So the service is, as I mentioned, available for employees, but it's also available for managers as well. And this is a great tool for managers to use should they come across any complex situations with employees. And it could be used as an intervention tool. So provided that the awareness of the program is made clearly within the organization, that employees are aware, but also managers are aware of how the service works, the managers can also keep an eye out for those individuals that might be experiencing a tough time at home or a tough time at work. They may have gone through some changes in behavior. You may know that there is some issues happening in their lives. You've seen some signs in change of behavior, amongst other things. A manager can refer an employee to the program. So the majority of employees will actually contact us themselves. They'll see the information, they'll contact us and receive the support. And informal referral is where a manager will know some information about the service. They know that an employee is maybe going through a bereavement or gone through a divorce, and you've just given them the details of the support service. They can connect in and get the support. A formal manager referral is where a manager will complete a form signed by themselves and signed by the employee, who then has to consent that the employee consent that the support service can reach out. So if they give us that consent, it's completed on that form, it's sent to us, and we can make that outreach. So sometimes taking that first step can be a bit challenging for some people. This particular method really helps. This process is a great way of kind of helping and encouraging them to get the support that they might need. So that's the referral scheme, and that's available for managers. Managers can also use the service for Manager Assist, and that support is via our manager consultation. And moving on to the next slide, this will show us a bit more information about this. So Manager Assist service is basically a practical guidance available for managers about any complex situations that they might be coming across. So Manager Assist is not designed as a substitute for the support you have from your own HR team. It's available as an additional source of expertise to help you when you feel you need it. So Manager Assist is staffed by a senior clinician who can help with those complex situations. And the practical guidance to help you, for example, identify troubled employees, resolving employee conflicts, managing challenging personalities, addressing bullying, delivering bad news, amongst other things. These complex situations can be challenging for some managers. You might be a new manager and you don't know how to deliver bad news that a well-loved employee has recently passed away, or that you need to announce some changes in the organization, like layoffs, for example. Or it could be, how do I approach two employees who are experiencing conflict between one another? How do I approach that situation? You can get some emotional support, some coaching through one of our trained clinicians who can help you approach that situation more effectively. So the support is available for managers as well, something that's key. It's available from June 1. Once again, this is a new feature that we've added for the support service program. So those complex situations that managers need some guidance on, they can reach out to us and discuss those. And as I mentioned earlier, we're not there to replace HR or to discuss any company policies. There's more emotional support that we can offer to that manager around any situations that they might be coming across. As David mentioned earlier, absenteeism, sick leave costs a lot of money to organizations. So using such a program like the support service can be a great intervention tool before someone goes into sick leave or long-term sick leave. So we can, if you can identify them, if you can't identify them, you need some guidance, we can speak to you. But we're there to support employees, we're there to support managers and the organization. So it's a confidential resource that is available to your organizations. So yeah, just want to kind of highlight, there is a QR code on the screen. You can scan that and ask questions or leave feedback. Rebecca, anything else you would want to add?
No, just thank you, Mo and Dave, for that. As Mo just referenced there, and I alluded to earlier, we would really appreciate it if you could take a minute or so just to complete the short survey. So the QR code is on screen. If you could just take a minute to do that, it would be appreciated. We will also share a feedback link with a copy of the slides afterwards. But we'll leave that there for a minute, and I was just going to jump into a couple of questions. If we don't have opportunity to answer everything. We will take them away and share written answers. So firstly, Mo, I think this one's aimed for you. So who are these options aimed at? Is it for ZM employees or included as part of customer offerings?
So this particular program is offered for employees. It's offered to customers. This is a program that is offered to a wide audience. So we've worked with Zurich for a number of years, and this offering is being offered to a wide range of portfolios. Within the commercial, within the municipal, it's obviously offered to employees and to their immediate family members. And not to forget, obviously, the managers as well. And that's quite important that they are aware that they can reach out and get the support that they might require.
Brilliant, thank you. I can just see one of the questions here that feeds into that. So are these services available to all on this call? So local authority ZM, yes, they're available to both commercial and ZM customers. Dave, got a question for you here. What do you see as the biggest blockers for companies in terms of managing well-being in the workplace?
Yeah, most of the studies show it's a lack of resources. From my experience, that doesn't necessarily mean just sort of throwing money at the problem, because it's quite complex. I think the main resource to give a list at the beginning is human resource, and give people the time to sort of really explore the issues. Most organisations are doing a lot more than they might think. But having sort of the time to pull all that together across health and safety, human resources, learning and development, for example, that takes a little while, and getting, setting up, small forums for worker representation to get feedback from them. Yeah, it takes time, not necessarily a lot of money, but that's the key bit really, is giving sufficient resource.
Thanks, Dave. We've probably got time for another question before we wrap. So can we get leaflets to put in strategic points of the business as communication? So Zurich do have more, I don't know if you have anything more to add, but we do have like one-page flyers, posters regarding support services. So it highlights the services that are available along with the contact information. So that's something that we can easily share with you, and your relationship contact will be able to do so.
Yeah, and there are some additional resources as well, if and when required. So we can certainly share this accordingly with Zurich, who can then certainly forward that across to all of their clients and employees. So yeah, we can certainly share more service-specific flyers along with the standard one pages as well. So yeah, there are some additional resources that we can certainly share with the organisations.
Thanks, Mo. And I'll just touch on one more point before we close. So Claire, you've asked how do we share the recording with customers who are unable to attend? So we will be sharing the slides with everybody along with the feedback link, but the recording will be uploaded to Zurich's YouTube. So there'll be a link for that again, which you can share, that references all our webinars that have taken place. If any other questions pop through that we have missed, as I say, we will pick them up. But thank you, Mo and Dave. It's been much appreciated. Thank you, everybody, for joining. And with that, I will close the event. Thank you.
Thank you, everyone.